of scapula, superior to the spine in supraspinatus fossa, inferior to the spine, infraspinatus fossa. Now, this side, which side we have the spine of scapula? This is the dorsal side. Subscapular fossa. Sub means below. So here is the subscapular fossa. Opposite, like not towards the side of the spine, opposite toward. This is a shallow fossa, subscapular fossa. Now, this is actually the right scapula. How I know it is the right scapula? Because it will articulate like this, and here the head of the humerus will articulate like this. So this is the right scapula, and this humerus is the right humerus. So now we will cover the humerus. So head of the humerus. This round ball shape is the head of the humerus. Now greater tubercle and lesser tubercle. This bump here, this is the greater tubercle here, and this small here is the lesser tubercle. Like some part is like broken, spongy bone we can see. Between the greater tubercle and the lesser tubercle, we have the intertubercular groove, this one, between the greater and the lesser tubercle. Now, this one here, see this one here, this line here is known as anatomical neck, this one here, anatomical neck. So this is the anterior side. On the anterior side, we will look at this fossa here is known as the coronoid fossa, this one here. This, like this part here, from here to here, this is the trochlea, this one. And this, which is smooth, is the capitulum. So this is capitulum, and this is the trochlea. Now, lateral epicondyle. So head is towards the medial side. So here is the head. It is towards the medial side, see? And so towards the head, if we go down, it is the medial epicondyle. Epi means outer. So this is the medial epicondyle. Opposite to the head, if we go all the way down, here is the lateral epicondyle. This is the lateral epicondyle. And near the lateral epicondyle, this shallow fossa is the radial fossa, this shallow fossa. And this is the anterior side. Now we change it to the posterior side. On the posterior side, this deep, see, it is a lot deeper in comparison to the coronoid fossa. This is the olecranon fossa. In the olecranon fossa, the trochlear notch of the ulna will articulate and will form the elbow joint. So this is the olecranon fossa. Now we will move to the radius. We can identify radius right away because the radius has the head, and see, it is round and it looks like a disc. So we can identify radius like right away like that. Another thing, radius has like here, the bump. That is known as radial tuberosity. Between the head and the radial tuberosity, this part is the neck. This is the neck. And the styloid process, if we go all the way down, this is the styloid process, this one. This one is the styloid process. So now we will move to ulna. This is the ulna. In the ulna, this process here, is the olecranon process, this one. Here is the olecranon process, and this one here is the coronoid process. And this look like is like monkey wrench. This is the trochlear notch. This one, trochlear notch, which will articulate with the olecranon fossa of humerus. Here actually, see here, this is the radial notch. This one. So olecranon process, coronoid process, trochlear notch, and the radial notch. So ulna is the bone which is towards our pinky finger side, this side. It is more medial. The radius will be towards the thumb side. Now we are done with it. Now we will go through the hand. So here is the hand. In the hand, all these actually, these are the wrist bones known as carpals. These are the metacarpals, 5 metacarpals. Then we have phalanges. These fingers are the phalanges. And in the phalanges, for example, this is the proximal, medial, distal. In the thumb, we have only proximal and distal, no middle. So now we will go towards these like the trapezium, trapezoid, all those. So I will start here. So now this is towards the thumb. So towards the thumb, this carpal bone is the trapezium. The second one here is the trapezoid. This big one, we see this big one, which is actually below the middle finger, that is capitate. And the next to the capitate, this one is the hamate. Now, this is the pinky finger. Towards the pinky finger, you see like these two are joined together. So this one here is the pisiform, and the second part is the triquetrum. This part is the triquetrum. This is the lunate, and this is the scaphoid. So I will go again. Trapezium below the thumb. Next to trapezium here is the trapezoid. Capitate is below the middle finger. This is hamate, and here like two small. This one is the pisiform, and this one is the triquetrum. Then we have lunate and hamate. So these are the carpals. So now we are done with it.